here today with Lee. Thank you for letting us share your video today. We're going to be doing some facial fillers. Any questions about our goals for today?
No.
Okay. So Lee used to do a lot of modeling, and can we share with them how young you are?
85.
85 years young. Amazing. What an honor to help you today. Can we show them your picture from before? Yeah, so she brought in some of her pictures where you can see how the facial volume really changes over time. So beautiful. And we're going to put that volume back in. Just such elegant pictures here. And we have her pictures for today. Can you bring up her photos there, Ari? Yes. So today what we're going to focus on is, thank you, we're going to build in the smile lines. We're going to build in the cheek, a little bit in the temple and the brow. And I might do a little in the jawline, but I'm going to focus up here first. Very good. So, Lee, you mind if I ask, what was it that inspired you to have a cosmetic treatment done?
Because I can't stand to look at myself in the mirror, even when I put on my makeup. I didn't wear makeup today because, I wore mascara, but
Got
that
it.
was all.
Very good. Well,
I do look a tiny bit better when I put on makeup.
Got it. Well, you've come to the right place. We don't want to be too hard on ourselves, but we're going to do a little cleanse on the skin. I'm going to have you rest your head all the way back. And as you can see, Lee is very fashionable, and her hair is done well, and she dresses very, very stylishly. And so we're going to do our part to boost things up and build that volume. Not too much. Family and friends, they don't figure out what you had done when it looks natural. We follow the ABCs of plastic surgery. When you know the ABCs, you make your best decisions because you understand the bigger picture. I like to use the vibration technique when I'm doing the numbing medicine. So Lee, you're going to feel buzz here, and then pinch on 3, buzz and pinch, 1, 2, 3, pinch. You feel small, medium, big pinch, not too bad there? You doing okay?
I couldn't feel it.
Okay, good. 1, 2, 3, pinch. 1, 2, 3, pinch. So this is subcutaneous. 1, 2, 3, pinch. Little pinch.
Yeah, that one was.
1, 2, 3, pinch. Little pinch. A little tender there. Take a little break. We're not in a hurry.
No, I'm great.
Ali says, good morning, love your suit.
Hello, thank you. 1, 2, 3, pinch. 1, 2, 3, pinch. 1, 2, 3, pinch. Lee is very active. What kind of exercise do you do, Lee?
I was jogging a half a mile and then walking a half a mile there and then jog, same thing back. And then I quit, but now I'm just walking.
There you go. 1, 2, 3, pinch. And corner of the mouth, a little tender. 1, 2, 3, pinch. Sorry, a little tender. Now I'm going to do some through the lip. We'll do a tiny bit of plumping there. Not that much, so I'm going to lift your lip and it feels good. Now close your mouth for me. Close. And we're just going to, there we go. That's perfect. And then you feel, and then just relax your facial expression as best you can. That's good. So you feel pinch on 3, 1, 2, 3, pinch, little pinch. You feel small, medium, big pinch. Okay, you're doing good. You got the thumbs up. Go slowly.
That's not bad at all.
Thank goodness for lidocaine.
Yeah.
And I use a little shiver technique to put a very fine amount of filler over a large area.
I used to have okay lips in the pictures.
We'll just do just a little plumping, not too much. How about their little pinch? Not too bad?
No, not at all. You are darn good.
Well, you get the hang of it after 20,000. Leah has done her modeling far and wide, so she was on billboards and did all sorts of print, and so she has commercials and
newspaper, network.
And a little bit on the bottom here. 1, 2, 3, pinch. Sorry, a little pinch there. Everything's looking good. Lee is tough. But you don't have to be tough to do these treatments. We make it easy for you. There's no restrictions afterwards.
You should know what I've done. It's really tough.
Everything's looking good. And Ari and Yesenia have everything set up perfectly, make it very easy for me. So I'm going to take a little break there, and we always blot. I promise there's no bruising. How are you feeling?
Right. That is no big deal. Of course, I can take pain. That's no big deal either, but wow, that was nothing.
Lisa,
Thinking about a needle, that was nothing.
Good.
Lisa asked, how much does something like this cost?
Well, it depends on how many syringes you use. So to give you the best price, it's a good idea to do a consultation. You can go to imagelif.com/pricing or give us a call, 813-463-9245, and we'll put a plan together. There we go. And then you feel a little bit of a pinch here, a little pinch, not too bad.
Little bit.
Thank goodness for lidocaine. Little pinch there. Good. And little pinching here. Little pinch. So what I'm going to do is I'm going to start around a very fine amount to treat some of the creases. You feel a little pinching there or not too bad?
Didn't feel it.
Little pinch there. We do our best to avoid the bruising.
I'm fine. Crazy. No big deal.
Okay, so I'm using the Versa, and I'm going to start tonight. Yeah, this is perfect. So I like to start with the corners of the mouth. We mix a little bit of lidocaine in because we get that downturn of the corner of the mouth. Get a little pinching there. So we take our time, always fast but never hurry. For the physicians and students that are watching, this is a 32 gauge needle, which is the least amount of trauma, least amount of bruising, and you have to go slowly when you inject. So that's a little bit in the corner of the mouth. And then I'm also going to treat a little bit of these fine creases. And you can see those plumping out nicely.
Oh yeah, I got those. Really bad there.
You come to the right
Not
place.
the needle, but my skin.
Okay. Everything's looking good. You feel a little bit of a pinch here, not too bad. Little pinch.
Mm-hmm.
Go slowly. And a little bit in the corner to build that volume up.
Yep, don't feel that one at all.
Thank goodness for lidocaine. So the ABCs of plastic surgery, when you know the ABCs, you're going to make your best decisions because you understand the big picture. So A stands for area. There are 4 areas that we address. If we sag, we tighten. If we lose volume, we fill. Sun damage, wrinkles, and sunspots to the skin, we can polish and repair the skin. The 4th area is better than everything else. That's our behavior. So a little pinch there. Nothing looks as good as Mother Nature's free facelift when we smile. A smile always looks the best. Feel a little pinching there, not too bad? And just a little bit of a plump, not too much. We stay away from the corners here because you don't want to create a tubular appearance at the corners of the mouth. You need that taper. It's really important for the artistry of what we're doing. Just a little touch there. Very good. Everything's looking good. How are we feeling? You doing all right?
Yeah, you make me smile.
That's okay. That's all right. You can smile. I can still do what I need to do. I feel a little pinch there or not. So little touch. I'll either use half of a tenth of a cc or a full tenth of a cc in the vermilion border in each quadrant. And you can see it nicely plumping up. Everything's looking good. Perfect. So just a little bit of plump to the lip there, and then a little bit in the corner of the mouth, a little pinch, or a little pinching there. Those little creases. Go slowly. Around the mouth is important because that's where we interface with others, so we want to do our best to make sure we fill as many of the creases as possible. So we talked about areas, the boundaries. Safety's first, you must look natural. Prevent future aging, let's get as much improvement as possible. That's B for boundaries. C stands for combination treatment. Now, if you want your best results, we combine tightening, volume, and skin for best overall results. Best results with just one treatment is lifting and or laser. Best results, no downtime, fillers. Fillers do a great job, but they don't give us a lift. Lifting, I get wonderful results, but I can do even better when I combine. So if you know the ABCs of plastic surgery, you'll make your best decisions. D stands for different perspectives. We never see ourselves the same way that other people see us, which is fascinating. Even though we're looking at the same thing, we do not see ourselves the same way that others see us. We look at others socially. We look at ourselves seriously. And that's the reason people get into trouble. They go too far. Let me turn your head this way just a little bit. So now we're going to build up the cheek. The cheek is one of the main tent posts. Pressure pinching. You feel a little pressure, a little pinching. And shiver technique for a fine amount of filler over a large area. Everything's looking good. How you feeling, Lee?
Right.
She'll feel goofy with the lips are swollen with the numbing medicine, but we go slowly. We're building up a little in the zygomatic arch. Lee is such an inspiration, being in her 80s and looking so good and so full of life. That's the best part of what we do, is the people we get to work with, and Lee is full of life. Everything's looking good. A little bit of the hollow, and I'll fill some in there. Everywhere I inject, it makes it a little more numb because there's lidocaine. We add a little extra lidocaine in the product, and it's smoothing things out, just plumping, restoring that natural volume that we all had in our younger pictures. And we'll show you her pictures again. You can see from her. Can you show them one more time? If you're just now joining, you see here's Lee's pictures from today, and then here's her previous pictures when she was doing her modeling. Very elegant woman. And you see the before and afters. Very good. So I'm just still building here out in the cheek a little bit. Thank you, Yesenia. Little pinch there. Little pinch. So I'm going to massage that one area. Do you feel any pinching right now?
Yeah, I didn't feel the other, so when I felt one.
So you surprised you a little bit.
Yeah.
Sometimes they'll feel, so now I like that when you look at comparison between the two, how soft that is to compare to over here. Now we're going to do it on the other side. We still have some filler left. We're going to go slowly. Everything's looking good. Pressure pinch.
I'm great.
Yeah, I tell my patients, if you need a break, you let us know. I'm not in a hurry.
Goodness, no. Oh, goodness, no. I'm workaholic, work all day without food or drink if I need to get a little coffee.
She's tough.
So oh yeah.
Full of life.
I do what needs to be done. Accomplished.
She gets the job done.
You know what? I work a full-time job and kept work for the fair shop, and on weekends worked out a new dealership in Atlanta and paid my way through law school, and then sent my parents invitation to my graduation.
Wow, how wonderful is that?
See how what a, like I told you, I'm a workaholic.
Well, it's not work if you love what you do. Little pinch there, a little bit of numbing.
Mm-hmm. I didn't eat much. Crystal was 38 cents each at that time, and I'd eat one about sometime every night. That was my meal for the day. So I didn't eat, but I got my education.
You got your nutrition in.
You know, I shouldn't be talking.
You can talk, it doesn't bother what I'm doing.
Okay. my husband, it was his, not ours, it was his law firm in Kennedy. He died. I've been divorced for years. But he had an apartment, had good friends, and I didn't know about till after the divorce. But he wouldn't let me work in the law office. And he had some friends that I was smarter than he was, and he wouldn't let me work in the law office. And then, do you know Glenn Turner?
Well, we won't mention any names. We'll keep it, because we're teaching, doing our teaching video, so.
Oh, I forgot. Hush.
That's okay. You can talk, but
I'm so sorry.
you can talk about things, that's
I should
fine.
have more knowledge.
Well, there's a little bit of the numbing medicine going on, so that's okay, no problem. You're doing great. I'm so happy with the results I see. I like to build in the nasolabial fold. Some doctors don't like to inject there because you want to build that premaxillary height because we lose that volume, and it's important to proportionately replace the volume, especially when you're doing full face fillers. So we got a little blend in the lip and a little through here. I'm going to do some in the back, and it's wonderful how you just see everything kind of plumped together. Let me turn your head this way a little bit.
Patricia asked, what kind of procedure is this?
We're doing liquid facelift with that hyaluronic acid. This is the Versa. Lee, how you feeling, dear?
Right.
Everything's looking good.
So sorry, I spoke. So sorry, I spoke.
Perfect. Just replacing that volume little by little by little. Just a little pinch there. And this is the pre-gel sulcus melolabial fold. I'm just building up that volume.
Kathy asked, is this permanent?
This is not the permanent filler. We have permanent filler, but this is a good option just to see how the liquid facelift does for you. And you can always choose different types of fillers later, but the Versa is a very popular choice. And turn your head this way a little bit. There, to your left, thank you. Very good. Pressure pinch there, a little pinch. I'm going to do a little more in the cheeks, then I'm going to do some in the temple. Very good. Everything's looking good. How you feeling, Lee?
Great. Happy? Great.
Very good. We'll be done before you know it. We're right on track. Turn your head this way just a little bit.
How long does it last?
From liquid facelift, people usually can get about a year or two when you're using this much volume. Depends on the type of filler. Versa, Voluma can get that type of result from the hyaluronic acid. Sculptra is 2 to 4 years. Bellafill is permanent, depending on which filler you choose as the longevity of the liquid facelift. Very good. Now I'm going to blend laterally and inframalar, submalar, subcutaneous. Everything's looking good. Thank you for watching. Thank you for sharing. We get the thumbs up from Lee. Perfect. Lee, did you tell your friends what you were doing today?
Of course not.
Well, if you didn't tell them, they're not going to know. I don't see any bruising right now, but you might bruise from the filler, but you can cover that with makeup. And I love the contour that I'm seeing here. And then I massage immediately afterwards. You cannot hurt the filler. And this filler does not move. There's really not a mechanism for the filler to move. So I like what I see there.
Lisa asked, what's the average price and how many syringes are being used?
So we're going to use 6 today, and the best thing to get a price is, we don't want to mislead you by saying here is a price. It depends on what you're looking for, what you choose, temporary, permanent filler. They do have a few specials, so best is to call in 813-463-9245 to get a price based on what you're looking for, or go to imagelift.com/pricing, and you can get a customized price there. Turn your head here, that's perfect. Now let's do a little bit on the other side. And turn your head here for me, please. Thank you. Very good. How are you feeling, Lee? You doing okay?
Great. I'm great.
She's tough.
To be blessed to have you as my doctor, that's the greatest.
You're so sweet.
Greatest.
You're so kind. Thank you. That's very thoughtful. I do receive that, and I'm very grateful for our patients. We are dedicated and committed to getting the safest, most natural looking results. We are a center of excellence that we focus only on the face. We don't do anything for body, breast, tummy tuck. When we're doing the facelift, if we pull really, really tight, sometimes we get a little tightening down below, but usually it's just the face. I'm just kidding. That's my little joke. We just focus on the face. Everything's looking good.
And the employees you have in this office are just the best.
Thank you. We have great team members.
You have a
Yesenia
great
and Ari
team.
and Christine. Everybody here really does a great job. I'm very proud of our team members. I feel a lot of love in the office every day, and they take great care of my patients as well. Everything's looking good. Now, what I tell patients is immediately afterwards, when you see the filler result, you don't want to taste the chocolate cake before it's done baking. You want to resist that temptation because you need the swelling to settle. For the hyaluronic acid fillers, you're going to have water absorb. Now, let's take a look here. I think doing some in the brow is going to help us out. Yep, it's all looking very natural and very good. So let's do a little bit in the brow, not too much. I'm going to turn your head this way a little bit because we deflate in the brow, so now we're just going to re-inflate a little bit. This is advanced technique, not for beginners, so you definitely need to know the anatomy. I'm subcutaneous here. Twist, twist, twist. A little bit of numbing, a little bit of filler. Everything's looking good. Nice and slow. You'll feel that get a little numb. You doing okay?
Great.
And I'm going to massage that area through. Very nice. Same thing on the other side. For the physicians and students that are watching, I do like to go immediately over to the other side before I go to another area. So that way I can put equal amounts in the same areas on both sides, just to keep you on track. Pressure pinch. Because it is highly customized, and we will do things differently for different patients, of course, depending on what they need, depending on what they want. So this is subcutaneous. We're staying away from the neurovascular bundle. Fillers are very safe. The Versa is even reversible, but it's very rare that you need to reverse the hyaluronic acid. I'm going to do a little bit in the temple. Let me turn your head this way just a bit. So with the temple, for all the filler technique, I do the twist technique to advance, shiver technique to put a very small amount of filler over a large area, and then hydrodissection. Once I inject a little bit and then I massage that in, that makes subsequent injections a little easier because now there's a little more space to maneuver and place the cannula from the previous injection. A little pinch there.
Mm-hmm.
Shiver technique, and the massaging as we go. Very good. And the temple really looks nice when we put the volume back because that's a very common place that we lose volume. Lee, how we doing, dear?
Great.
She's tough.
Absolutely great.
Can we share with them your age one more time? How young are you?
85.
85 years old. What an inspiration.
But I claim 39 every year.
There you go. That's the right way to do it, right? Just age is a number.
Right.
And if we want to look even younger, we just have to act immature. Very good. So twist, 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 a little bit of filler. Now I'm going to massage that area through. Perfect. So it's a nice little bit of volume we put through there. Normally I'll get photos at around 2 to 3 months. We can get photos as early as 2 to 3 weeks later, but usually you want to wait at least a month to just let things settle in, let the dust settle. You don't want to take photos too early because if you start chasing things and saying, well, what about this? Let me add some here, let me add some there. You need to let things settle first before you make decisions on future treatments. Everything's looking good.
They're running specials now on fillers. If you go to www.imagelift.com/prices, you can find that information there.
Yeah, give us a call. We can give you all of our specials, 813-463-9245. I used to do that stuff myself. My team is really good now about putting those things together and organizing them. So patients ask me what those things are. Actually, I don't even know myself, but I know we have some. And they last for a certain period of time. So take advantage of that while we've got them. Give us a call, 813-463-9245. You can reserve your special. Very good. So that's a nice little bit of volume, a little bit of swelling, which is to be expected. Same thing on this side. Now let's turn you this way just a little bit. Everything's looking good. How are you feeling, Lee?
Absolutely great.
We have the best patients. I'm so proud of our patients. They really take good care of themselves. People are living so much longer, and Lee has many active years ahead of her. So we're honored to be a part of her journey and help her look and feel her best, because when we look good, it makes us feel good. And then it makes us want to do good. So look good, feel good, do good. What we do here for many people is the single greatest self-care investment that they will make in themselves. So we are honored. And people need self-care. We need to invest in ourselves, especially today. There's so much going on. You read the news, frustration and struggle and challenges. We are here to help you feel good about yourself. It's good to take care of yourself. When my daughter was young, I remember we were making some tea together, and she said, you know, Dad, sometimes you just have to pamper yourself. And I'm like, well, that is so adorable, but it's so true. We've got to take good care of ourselves. And Lee is a living example of that. 85 years young. Good for you. Everything's looking good. I always tell my patients, if you need a break, you let me know. You doing okay, Lee?
Great.
We try and make it easier than the dentist's office or easier than getting a tattoo. Or easier than getting a tattoo at the dentist's office. All right, coming along very, very nicely. I've got a little bit left. So what I like to do for the physicians and students that are watching, Lee, if you would for me, can you just look straight ahead? I want you to look straight ahead. I really love what I see. It looks so natural. I'm going to add a little bit more to the cheek and down below. Very powerful. And I'm even going to build out a little bit in the chin to just give her more volume through here. Wonderful. Lee, I'm so happy with what I see. Let me just show you what we've done so far so you can get an idea.
I'm so blessed to have you.
You're so sweet. I'm not done yet, but can you see how it builds out the cheeks and the smile lines? How does that look so far?
I just don't, it looks good. I just don't like looking at myself.
Okay, I hear you. And that's a part of what we talk about. we don't want to be too hard on ourselves. Sometimes we can be a little hard. Lee has very, very high standards. Is that fair to say?
Yes.
She's got very high standards. Let me have you rest your head all the way back. I've got high standards too. But we need to make sure we're good to ourselves. And of course, Lee has a beautiful smile. So we do the best we can with what we've got. The rest is in God's hands. And I'm very proud of Lee for living life to the fullest, living life on her terms, inspiring other people with her sense of style and her passion. You feel a little pinch there or not really?
Okay, I'm getting over it again. I barely felt anything off of this.
Very good. So this is an advanced technique when you're injecting under the eyes. Make sure you are experienced in those areas before you take that on. Don't just see one, do one, teach one. And the safety cannulas are a must. They give you your best result. You're going to look the most natural, less trauma. You turn your head this way a little bit. Everything's looking good. Around the mouth is so important because you lose that volume and you see the creases there. So now we just want to build up what was once there. Very good. I'm going to turn your head this way just a little bit now. Perfect. You feel a little pinch there, not too bad?
No, not at all.
Perfect. I am a double board certified facial plastic and reconstructive surgeon. If you're just now joining, I'm Dr. Rich Castellano, the Smile Doctor. We're on a mission to stop bad plastic surgery. Thank you for sharing. I promise that you have family or friends that are thinking about doing the treatment, so share this with them so they know what their best options are. Twist, twist, twist to advance the cannula to the position and place where you'd like it to be. And then I'm going to go a little bit inferiorly here. Very good. Little massage. Follow the natural contour, the natural anatomy of the face. Always a little bit of swelling, but Lee is going to pass the grocery store test today. If she walks into the grocery, no one does a double take.
I don't mind at all.
Let me turn your head this way. So a little bit submalar, because we do lose volume in this area as well. Everything's looking good. And so one more time, I like to get the perspective. I'm going to take a look from the front. Very good. Make a big smile for me. Big smile, big smile. Now relax as best you can. Now that's perfect. Just relax the facial expression. So I'm just going to put a little bit more through this area and around the mouth to just plump through here. Last little bit, then we're done. You feel a little bit of pinching there, not too bad.
Not at all.
A little pinch. Pinch. Trying to fill in as many of these creases as we can. Little pinch. A little bit on the other side. Just enough, but not too much. We always have more creases on one side than the other. We have one side of our face that's a little more dominant. We get a little more sun on the left side. Usually because when we're driving in the car, we get a little more sun on that side. So I really don't see any significant bruising at this point, but bruising, of course, can come later. So we do our best to avoid it. This is just a superficial subcutaneous injection, so you're less likely to create bruising there. Okay, we're completely done. I like to do a little massage afterwards. So, Lee, if you feel any firmness, you can just do some massage across the brow, the temple, the cheek, and around the smile line. So let's take a look. So we did the 6 syringes of the Versa. How does it look so far? Big smile for me. Can you see how it builds up that volume?
You can see my teeth.
Yes, you can. And I like the volume. It's very uniform. But she was talking about how she had that little dimple in the middle. So that's evened out a little bit. Do you like what you see?
Yes. Can this be brought up? That's
So here's what happens. Right now you're a little numb with the lidocaine. So we got to let the lidocaine settle. That's a good question. So once the lidocaine settles, there are some things that can be done. But for now, we just got to let the dust settle. So, okay? All right. How does it look around the smile lines and the cheeks?
Great. Absolutely great. It's just that, see, you can see this whole little teeth.
That's perfect. And with the lips, what's really important is you just got to let that first set of swelling settle down and the numbness. When the lips are numb, puff, 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 puff. So for now, we just got to be patient. We don't want to taste the chocolate cake before it's done baking. I promise it's going to be good. Any questions I can answer. That will settle down some for sure. And then we're going to see you back at, I like to do 6 to 8 weeks. We'll take some pictures. We're going to take some pictures today. And if you need me before then, you give us a call. Any questions I can answer.
No, it is indeed a great experience.
I'm so glad that you like it. I give the hugs and hugs and hugs from here. Hugs for you guys. Thank you for watching. Now, here is her result, but let's take a look. Here's her photos. I'll bring this over so you can see how the volume plumps out very nicely. In the hollows under the eyes fill in very nicely. Even on the brows, we get a little bit more volume. The creases, all looks very good. The lips don't look overdone. So congratulations. And then once again, here's her pictures from her modeling. We're just putting back some of the volume from before. So an honor to work with you, Lee. And thank you all for watching. We'll have more videos soon.